Well, mental health is really your emotional, your psychological well-being. Those are just really fancy words for how you feel about yourself, how you feel about your life, how you feel about your relationships with others. Changes in your mental health can actually impact your behavior and your thoughts and your feelings. But what's interesting is that the changes that we make in our behavior or our thoughts and our feelings can actually also impact our mental health. So it's sort of like a two-way street in that sense.
Yeah, that's interesting.
Mental health can impact other areas of our lives as well. Things like I said earlier, our relationships, but also our job and our school performance, our sleep, our appetite, our energy levels, our ability to think clearly and make decisions. Really at the most basic level, it's directly related to our overall satisfaction with life.
That actually makes sense because as people call in looking for support or guidance or wanting to address their personal concerns, they're not calling in saying, I have a mental health concern. They're calling in saying, my relationship is in trouble. I can't concentrate at work. Communication is difficult. So that actually makes sense. They don't know what to call it.
You're right. People pay pretty good attention to their physical health. They get good nutrition, they get enough sleep every night, they try to exercise, and when they're sick, they go to the doctor, right? They talk to their doctor, they report their symptoms, and then hopefully put together a plan to address the issue. Well, mental health is just as important as physical health, but unfortunately in our society, it seems like there's still this stigma surrounding mental health or getting help for mental health issues.
I think it's important to understand too that a lot of people when they see their doctors regarding physical ailments that they're having may not always understand that there's a mental health issue driving it. Or that mental health issue may make their physical issue, like if they're diabetic or if they have a weight problem, make that problem worse.
I think that's exactly right. At the bottom line, when your mental health suffers, you start to feel run down, both mentally and physically. It can become hard or almost impossible to even enjoy life.
Everybody has their ups and downs. Everybody feels depressed or anxious at some point, and that's perfectly normal. I think when somebody is starting to have those ups and downs, especially those downs that are lasting for a long period of time, then it's time to start taking a look and seeing what's going on exactly. And how it's impacting your daily functioning, your friends, your relationships with your friends and your families, and anybody else that you're interacting with. Some early warning signs when it becomes a problem can include eating or sleeping too much or too little, pulling away from friends, family, coworkers, having little or no energy, not having the ability to do the things that you like to do, or sometimes you may feel numb or like nothing really matters at all.
Right.
Having unexplained aches and pains, like we talked about earlier. Those headaches or those muscle aches can be an indication that maybe you're feeling stressed or something's bothering you. You're feeling helpless or hopeless. Some people use alcohol or drugs to help them feel better. If that happens to you, that's a good time to really take an inventory and see, do I need to get some help? Sometimes we may get confused or forgetful. We may be a little bit more edgy, angry or upset. We may start yelling or fighting with our friends and our family. Little things may get to you more than usual. Maybe you start experiencing some mood swings that cause, more problems in your relationships. Or you have a problem performing daily activities, things that you usually do with little or no effort, like work or school or taking care of your kids.
Speaking of kids, I think it's important to point out as well that sometimes symptoms in children are maybe different than they might be for an adult. So for example, in depression, we often think of, when we're talking about adults, we think of, crying spells or changes in appetite, things like that. With kids, it might be different. They might be getting in trouble at school, or they might, be frightened and have nightmares. So I think it's important to keep in mind that, the symptoms might be different for different age groups or even different cultural backgrounds.
It's normal to see kids sometimes regress.
Mm-hmm.
They become more clingy with the parents when they're having problems.
Sure.
And that was a pretty long list of symptoms that you were talking about earlier. Does someone have to have all of those in order to be concerned, or
No,
is one or two enough?
Sometimes if you see yourself having one or two of those things, especially if it's getting to a point it's really having a big impact on your life, then that's an indicator that it's time to reassess and see about getting some help.
You know, just as we might work with a doctor to keep our body healthy, you can also work with a professional to keep our mind healthy. Behavioral health counselors have expertise in mental health concerns. That's their expertise, that's where their experience and schooling lies. We can go to a counselor and we can describe our signs and symptoms.
Sure.
They can help us kind of hone in on exactly what might be going on, and then also identify the best possible resources to help get you back on track.
So, like, what if it's not me, per se? What if it's a coworker? You know, what if it's someone else, a family member, a friend, a loved one?
Yeah, that conversation can feel awkward, feel difficult to start, but it doesn't have to be that way. It actually can be a pretty comfortable and impactful way to start the conversation. First of all, reach out, let them know you care. Even just acknowledging, hey, are you all right? Something seems a little bit different. You seem a little down, or whatever the case might be. So don't be afraid to just kind of go there and bring it up.
It makes a lot of sense. I mean, if you noticed something was physically wrong with someone, you know, they're limping, you know, or there's, you know, some other sign that they're not healthy, I don't think we'd hesitate to bring it up, to kind of start that conversation. So I think it makes a lot of sense what you're saying, you know, to just bring it up and start that conversation.
Well, and listen, when they do start to share and open up a little bit, we want to make sure that you're comfortable hearing what they have to say, because that can be difficult for them to kind of put it out there. So they want to make sure that you're going to be an interested party and listen to what they have to say.
Well, and I think it helps too when you're talking to that person, not to go in there feeling like you need to fix it.
Right.
You know, your friend, your family, whoever you want to support, sometimes just listening to them, understanding what they're feeling, just acknowledging what they're going through can be hurtful or can be impactful for them. Sometimes is enough rather than trying to help them solve the problem or fix it.
Yeah, I mean, you might be interested, and we'd strongly encourage study up a little bit and kind of understand mental health yourself to the extent you can when you're researching a little bit, but definitely don't feel like you have to be their counselor then, or fix whatever it is that's going on. But you can be helpful in kind of supporting them and guiding them maybe to find appropriate resources to get to a counselor perhaps, because that can be difficult to navigate. And by all means, just support them when they've decided to talk about it and go seek some assistance. Be there to support them along the way. You know what, guys, this was really cool. I mean, being able to sit around a table and talk about mental health and signs and symptoms and what are we supposed to do about it, you know, I really think that is going to work to make a difference.
I think it's all just about starting that conversation. And, you know, I think that this is one way to do that. You know, watching this video today, and we want to thank you all for watching this video today. It's an important first step. Hopefully you'll take some time to look at some of the other resources that we put onto the website.
Yeah, let's keep the conversation going.